to be important to get an update on what's going on with the COVID vaccine. I want to limit it just to that and what the county effort is. So I got a hold of folks over the weekend, and Dr. Hammami is with us here. I'm sure he has his Zoom calls all stacked up with Lansing and Washington and God knows where else. Maybe he's still trying to get PPE out of Southeast Asia or something. So I want to allow that to go first under new business, that we'll get a quick update from Dr. Hammami and some questions from commissioners, and then we'll go into the business items. So hopefully that meets with the committee's okay. All right, and so we'll go on to item B, the approval of the November 24th meetings. What's the pleasure of the committee?
So moved.
All right, that was either Marecki moved and Dobbs supported or the other way around. All in favor of the motion, please say aye.
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 Aye. Opposed? All righty, Madam Clerk.
C, old business, there is none.
All right. So as we go into new business here, I'd first like to bring Dr. Hammami on. We are embarking on one of the largest public health, what do you want to call it, operations in a long time in this country, getting out 600 million vaccines for COVID. So I know it's early. I know things will change. It won't be a straight line getting from here to there. So we do know some things, we don't know other things. So Dr. Hammami, if I can bring you forward on this, our czar of COVID in the county. And despite the fact that we do know some things, but not others, Doc, could you just give us a brief overview on where the county is and what our participation is in this effort to get all of the COVID vaccines out?
Absolutely. Thank you, Mr. Chair. Good morning, everyone. Mohamed Hammami, Chief Health Strategist for Wayne County. As you mentioned, Mr. Chair, a lot of things are moving and changing as well. So let me start with some of the basics that some might be redundant facts. But as of this Saturday, we all knew that there were 3 phases of rolling the vaccine. The state has even modified that as of Saturday to 2 phases. So we have phase 1 and phase 2. Within phase 1, there are 3 sub-phases, phase 1A, phase 1B, and phase 1C. And these are prioritizing who gets what at what stage. So phase 1C is prioritizing all direct healthcare providers. So these are the health systems, the frontline medical workers, people that are in the ER, emergency room. These are people that are dealing with the COVID patients. And the way the vaccine is assigned by the state is through the CDC, and they assign it by the state, but it is shipped directly from the provider or the vaccine manufacturer to those entities. So the hospitals will get their shipments directly. And then the second priority group in the phase 1A are the EMS, emergency medical workers. And these, unless they are affiliated with a hospital, then these become the responsibility of the local health department to vaccinate. So this is where we at Wayne County, out of Wayne County, of course, will be responsible for vaccinating close to 1,300 emergency medical service workers. And that is all in the phase 1A. Also included in phase 1A are the skilled nursing facilities, both staff and residents, and eventually in the phase after, the long-term care. So those have been contracted with the large pharmacies. Again, the CDC have contracted with CVS and Walgreens, and they are the ones that are going to provide vaccine to skilled nursing facility residents and staff. But those that did not have a direct enrollment with the retail pharmacies are, again, the responsibility of the health department. We looked at the list, we compared the list of skilled nursing facilities that is in out of Wayne County and those that are enrolled, and we identified one skilled nursing facility only that is not enrolled, with a total of 218 between staff and nurses. So these are going to be our priority specifically in phase 1A. Phase 1B is what the state is calling the critical infrastructure. So this includes, it's a very wide umbrella. It includes government workers, people that work in public safety, including police and sheriff deputies, and then essential workers that again has a very wide designation, such as teachers, childcare providers, utility workers, transportation, agricultural workers, and all that. So this is phase 1B. Phase 1C is adults with high-risk conditions and people aged 65 and older were in that phase, but we heard unofficially yet that the state are moving those to phase 2. Phase 2 becomes everybody else. So anybody that is not included in phase 1A are going to be included in phase 2, I'm sorry, where we are expecting more vaccine, and we're expecting that this is where the mass vaccination efforts and the provider efforts are going to be happening. As you know, as of now, only one vaccine has been granted emergency use authorization, and that is the Pfizer vaccine. And that is the one that logistically requires what is called a cold chain. So it has to be shipped in certain insulated containers on dry ice. They are included with GPS device and temperature monitoring devices. Once received, they have to be stored in a minus 70 degrees Celsius, that is minus 94 Fahrenheit. And then there is when you take it out, it has to be diluted and then kept at a 2 to 8 degrees Celsius, and then it can be administered. This vaccine, the Pfizer vaccine, is being shipped to entities that can maintain that cold chain. Wayne County has been designated as one of those places, and we are also included as a hub. By a hub, that means we will have the ability to administer the vaccine, but we will also have the ability to distribute the vaccine and store it for those who cannot store it. The Pfizer vaccine comes in trays. The minimum you can order is one tray. The tray has 975 doses. We have been told that Wayne County Public Health is going to receive 1,950 doses as this first shipment, and we're expecting it as early as this Wednesday. Once the first shipment is received, the state informed us, we don't know when, but they said that if we receive it on Wednesday, then all following shipments would happen on Wednesday. So we don't have to guess that are we getting a little on Friday or a little on Monday and all that. So that's the system they are having. But we don't know when the second shipment is going to be. It is noteworthy to say that the federal government has purchased 100 million doses of the Pfizer vaccine and 100 million doses of the Moderna vaccine. The Moderna is expected to be probably granted emergency use authorization on this Friday. Of course, that is less fragile, so logistically you don't need all that cold chain, and this is probably going to be shipped to places that do not have the capacity for the ultra low freezer. But we've been also told by the state that we as a health department can get the Moderna vaccine, and we are planning as well to submit to get it. Of course, we wanted more, and everybody wanted more. Even there are health systems that received less than we are getting, and there are health systems that did not receive anything. And I think part of it is because of that limited initial supply that the federal government has secured from the manufacturers. Our plan for the 1,950 doses that we are getting is to follow the same priority. We're starting this Friday with our own vaccinators. So this is where our public health staff, those that are going to administer the vaccine, we will start with those. We also have reached out to the 1,300 EMS workers in the county. We gave them a survey that to tell us whether they want us to go vaccinate them, or they want to take the supply and vaccinate themselves. We received some of that survey. We gave them till Wednesday to give us what each EMS entity is their preference is. We are planning to start with our hab building. Many of you who visited the hab building, we have a garage with 2 bays. I think this is how we're going to do it, as a drive-through for this initial stage, because we certainly want to test how the process is happening, and we want to keep it at a control. We are expecting a vaccination capacity of 100 doses per day. We also are very cognizant that this vaccine might have some uncomfortable side effects, so we don't want to vaccinate everybody from one single entity at once where they're all having mild fever or tired or whatever. So we want to stagger those as we go. We are going to be open during the Christmas break to maintain our vaccination rate, and if we get more, and we expect to get more, then this is where we have a plan of doing 3 approaches. We certainly have currently public health staff that can give the vaccine. We are looking to hire more as we need to increase our capacity. We are also looking at third-party vendors, specifically those that are currently performing the testing, since they have testing sites in the field, specifically the D Group and Memorial Health, where they can also administer the vaccine. And this is our next phase in planning how we want to roll it as a mass vaccination plan. We will do something in the future, again, when we have enough supplies. We will probably be considering things such as we did for H1N1, where we do mass vaccination sites. Many of you know the term POD, or point of dispensing. We have 17 agreements for closed pods and open pods in place, and we're expanding those. This is where we can either supply a pod with the vaccine and they can vaccinate their workers, or we can have it as open for the public where we will be doing it. And that's in a very broad picture what our plan is. Again, we are monitoring anything that changes, and this plan is probably going to be tweaked several times.
Perhaps even several times a day, Dr. Hammami, as we roll this out. All right, we're going to go around the horn with questions for committee members. And we'll start. Commissioner Marecki, are you ready to start with a few questions for Dr. Hammami?
Yeah, thank you. Is this a 2-part vaccine?
Yes, both the Moderna and the Pfizer are 2 doses. So the Pfizer, and one is 21 days interval and one is 28 days. I believe the Pfizer is 28 days. And we asked, and everybody asked the question, do we split what we have now and save it? And the state said, no, go ahead and give whatever you have as a first dose, and we'll ensure that you get enough for the second dose.
Okay, okay. And these vaccines are not mandatory in any section yet, right?
Not yet, not that we know of. No.
Okay. Thank you.
Thank you, Commissioner. Commissioner Dobb, do you have a question? Yeah, I see you, Glenn. You're next. Commissioner Dobb, do you have a question?
Yes, thank you, Mr. Chair. So one thing that I've heard being brought up with areas that are more rural is the concern about opening up the vaccines and not being able to distribute them, and then I guess they go bad after a while, or if you can't keep them cold, there's an expiration time. Do you have any concerns with that in any areas of Wayne County being distributed?
Yeah, so we have clear protocols on how to handle that, and you're absolutely right. The vaccine is good for 6 months as long as it's kept at the -70 degrees. Once it is thawed and it's kept at 2 to 8 degrees, and this is where you reconstitute it, it is good for 5 days. At room temperature, it is good for 6 hours only. So that's why each one of those trays have vials. Each vial is of 5 doses. So the protocol is you do not get anything from the freezer that you do not know that you are going to be using immediately. And this is where all that is planned ahead of time. And this is something that not only for this vaccine happens to have more fragility, but everything else, even the flu vaccine or even the childhood immunizations. Whenever we do field, we use temperature controlled containers. Everything is data logged. We have monitoring devices that keeps the integrity of the vaccine, the temperature variations and all that is documented.
Okay, and then you don't anticipate any issues with expiring, us opening up vaccines in Wayne County, we're not.
No.
Okay, all right, great, thank you, that's all I had.
Sure.
Thank you, Commissioner. Commissioner Anderson?
Yeah, thank you, Mr. Chair. Dr. Hammami, could you address the storage issue? Are we prepared for freezers? I mean, do we have freezers right now? Because I believe we just approved some dollars to purchase a freezer, and I just haven't seen anything come through for those. Are we sharing those freezers or using that space with some of the medical facilities? Is that what we're doing in the short term?
So this is a great question. Christmas came early this year, and we had one freezer from the state. So we currently have a freezer in the HAB building. It's plugged in, and it's being monitored for temperature and all that. So we currently have the capacity for 50,000 doses in one freezer. And as you mentioned, we requested another freezer that has been approved, and it should be coming our way. So 100,000 doses is probably more than enough, but we also have some plans and backup plans where we can use some of the hospital systems, specifically Beaumont, to store some of the excess if we have some. And this is again part of the protocols and the plans that we have in place.
Okay, appreciate that explanation. I know Macomb County, I think, has purchased enough freezers that they're going to actually share space if necessary too. So sounds like we have a good plan in place. Thank you. That's all I have right now.
Thank you, Commissioner. Vice Chair Baker McCormick, questions?
Thank you, Mr. Chair. Just a clarification of once you receive the shot, how quickly do you need to take that second shot?
So the 2 doses have between 21 to 28 days, depending on the vaccine manufacturer. I believe the Moderna is 21 days and the Pfizer is 28 days.
And so when you take the first shot, are you coordinating with them to take the second shot? Or are you doing that by appointment? How are you going to ensure that the second shot is taken within that time? And if they don't get it within that time, is there, do they need to start the process all over again?
Great question, and the first part is much easier to answer than the second one. Let me start with the first one. So absolutely, it's just like let's simplify it to childhood immunizations. As you know, we do it at 2 months, 4 months, 6 months. So you get the first shot, you are scheduled immediately for your next appointment. So for the second dose, there are several tools that the state is putting in place. There is a text messaging tool. Once you're registered to receive it as a reminder, there are mailing postcards as well. We certainly are going to follow up and call them. And then finally, there is the traditional vaccine card that you have it that says your next shot is on such and such date. So this is part of how we are going to ensure that they are reminded constantly and we do not lose any of the first dosers to get their second dose. The second question is something that we still are not clear on. We're waiting on direction from the CDC to say, is there a grace period? So instead of day 28, you showed up at day 30, can you still get it? Or if you are out of that window, what does it mean? Do you have to go back and get the first dose and then get redosed? Or can you still get the second dose? So this is still not clear, and we do not have a clear answer on that.
And then my last question, you said earlier that EMS workers would be given their shots, and they would take them whenever they would like, or I just wanted to clarify how that works.
So we received, as I mentioned, we distributed a survey. So we received some of the surveys that said we are capable of administering the vaccines ourselves to our workers. And I think this is good because we can then have the EMS that have been vaccinated to vaccinate others, and this increases our capacity. Of course, if this is the case, then all the protocols of maintaining the cold chain should happen, and we need to ensure that when they get it, it is still controlled, how they reconstitute it, they give it within the time window and all that. So this has to happen. And we also need to ensure that the data is logged in the MICR system, which is the vaccine registry, to capture everybody. So there is that possibility. For those that do not want to do this, then they will be part of our plan to do the drive-through through the hub building where we can give them the vaccines.
Okay, and so so you're not physically giving them the vial to take the shot themselves. That's not what you're saying, or
no? Some might, yeah. If they want to do that, we will.
Okay, so my concern with that is, will it be an ability for someone to take the shot and give it to someone else, or sell it, or create this black market of, of the virus vaccine, where people are selling it, or I don't know. I just don't know how you regulate if you give it to them, whether they took it or not.
Yeah, so currently we do have, or in the past, we used to have what is called the VFC program, where we would give clinics or physicians, specifically pediatricians, we would give them doses of vaccine and they administer it to their patients. Of course, there is a strict protocol and inventory. So if you're in a fire department and I give you 10 vials, then everything is documented with a log number, with a lot number of the vaccine, the manufacturer, and the date and all that. And then there is an expectation to get back all the registries of who got it and who didn't, and all this. So there is a checks and balances where we can mitigate any of these possibilities.
Thank you.
Pleasure.
Anything else, Commissioner?
No, that was it. Thank you.
All right. Commissioner Marecki, you had a follow-up question?
Yeah, thank you, Mr. Chair. Doctor, I've heard that they're warning people that have allergies to maybe not to get the vaccine. Could you tell us what kind of allergies that they're talking about, and what other kind of side effects are they seeing with this vaccine?
So let me do the second part. The side effects so far that have been reported are minimal side effects that are associated with any of the current vaccines. So there is a mild fever. Some people might feel fatigue. There is soreness at the injection site. There is a flu-like symptom for 24 hours. And of course, they vary in severity based on everybody's different response to that. So we're not expecting anything that is beyond that would last more than 24 hours. In terms of the allergies, as you know, the United Kingdom went ahead of us and they used this vaccine. And there were 2 cases where there was a severe anaphylactic shock in 2 individuals. And when they investigated it, it turned out that those 2 individuals had a pre-existing severe allergic susceptibility, and they even carry with them the adrenaline shots. So they are expected to have such a reaction. So that is a precautionary thing. If you have severe allergies and you are known to have to need the EpiPen with you and all that, then this is where the contraindication is. One thing about this vaccine is that it's not, as you know, Commissioner, Many vaccines use proteins, or they use different things that can be allergens. For this, the only vaccine part is the nucleic acid, which is the mRNA, which is not an allergen by itself. So it might be some of the components of what makes the other, maybe the diluent and all that. But we're not expecting any allergic reactions unless there are very well-known and documented allergic susceptibilities, and this is where caution is to those that might have it not to get it.
So would like a severe peanut allergy be something that you'd have to worry about? I mean, some of these people with this allergy, I mean, can, you know, go into major issues.
It is beyond peanuts. It has to be like mass allergies, you know, like you're allergic to so many different things.
Okay. All right. Thank you.
Thank you, Commissioner.
I'm all set. Yeah, thank you.
All righty. Yeah, thank you, Commissioner. Dr. Hammami, when we usually do this health stuff, Wayne County has a health department. The largest city in the state of Michigan is also in Wayne County, the city of Detroit, with their own health department. Usually we get grants and whatnot from the state, and the city gets their own. I have not seen that the city of Detroit has been designated as a hub by the feds for this, or whoever designated the hubs. So what is the working relationship going to be with the city health department here, city of Detroit?
We always coordinate with all our colleagues in neighboring counties and specifically with the city. We were surprised to know that the city is not scheduled to receive any doses in this first shipment. We reached out to the health officer and they were as surprised. We certainly are in dialogue to see what is needed. Now, most of the city of Detroit is where the big health systems are, and these are receiving theirs directly. So there is that balance, I assume. But if there is a need where there are surplus of vaccines somewhere and shortage at others, the state has a clear process of what is called redistribution. They still want to maintain the count. They still want to know how to do it. I think there is a specific mechanism where we can say someone has more and we need that, and how do you reassign them to us?
I got you. Well, that's good that they have that. And I guess typical governmental bureaucracy, it's not going to be 3 steps. It's only going to be 2, but we're going to have several sub-steps now under 1. So whatever. By the time they get to non-essential workers like, I don't know, county commissioners, I'm assuming that April is the window frame I'm looking at as a citizen for when this becomes available. What's your opinion on that, Doc?
That probably is a safe estimate. If we maintain a consistency in the doses provided, those phases can overlap and they can happen simultaneously at some point. But it might be safe to assume that when this is going to become open for the public, then we're probably looking at spring as that. And this brings us to the need that we should not let our guards off. So it would still be, you know, face covering and social distancing and restrictions and all that until we reach that point where 70% of the population is vaccinated.
70% is the magic number for the so-called herd immunity that people talk about, but very few understand.
That is correct. It's when
70%.
It's when the majority of vaccinated would protect the minority unvaccinated.
Well, that's good. I've kind of been using the number 80 to 85, so 70 will. Okay. Well, thank you so much. As you indicate here, Doc, I mean, this is going to be changing. A month from now, we will have a track record, much more of a track record of things like side effect of the vaccines and all of that kind of stuff. And it will still be a real minority of citizens who will have been vaccinated by 1 month from now, but there will be much more of a track record. So Dr. Hammami, if we can invite you back for our, I think it's January 14th or 12th date, just for a little update, because I think it is so important that good information gets out there, the right information, that elected officials that are putting out newsletters and talking to their constituents can also be very helpful in putting what the accurate story is out there, because we got some months to go on this, and
Sure.
and it's not going to be easy. But yeah, mask up, social distance, wash your hands, right, Doc?
Correct.
Yeah,
And I'll be more than happy to come back, Mr. Chair.
Well, thank you so much, sir. Any other commissioner have a question at this point before we return to the agenda? All right. Again, Dr. Hammami, thank you so much for joining us today. Now get busy with your Zoom calls.
All right.
And I'll go back to the clerk.